Tobacco control is essential to a healthy and sustainable future for all. In this video, we will describe the adverse impact of the global tobacco epidemic on sustainable development, preventable death and disease, economic losses for countries, families and communities, environmental damage. These are just some of the consequences of the global tobacco epidemic, which we will explain further later. In response, the WHO Framework Convention on Tobacco Control, or the WHO FCTC, was developed. It is the first treaty negotiated under the WHO and reaffirms the right of all people to the highest standard of health. The WHO FCTC is an evidence-based treaty with a range of actions to address the tobacco epidemic. Strengthening implementation of the WHO FCTC is essential to promoting health and well-being for all and to meeting the United Nations Sustainable Development Goals, or the SDGs. The WHO FCTC is known as an accelerator for the SDGs. The SDGs are a universal call to action to end poverty, protect the planet, and ensure that all people enjoy peace and prosperity by 2030. Now, let us take a closer look at the negative impact of tobacco on development. Around 80% of the world's 1.3 billion tobacco users live in low and middle income countries. On average, tobacco kills more than 8 million people each year. Of these deaths, 1.2 million are non-smokers exposed to secondhand smoke. The full implementation of the WHO FCTC will significantly curb tobacco use and reduce premature mortality from non-communicable diseases such as cancers, chronic respiratory diseases, cardiovascular diseases, and diabetes. Did you know that smoking is estimated to cost more than $1.4 trillion in economic losses each year? Almost 40% of this cost is borne by developing countries. The majority of economic losses arise from healthcare costs to treat tobacco-related diseases and productivity losses. These impoverish families and cost the economy. For one, families are forced to pay out of pocket in dealing with tobacco-related health issues in the absence of affordable healthcare. Tobacco use diverts money families could use for essentials like food, shelter, and education. Tobacco farmers are also exposed to various health risks due to the use of pesticides and handling of tobacco leaves, and are trapped in exploitative working conditions. In some instances, tobacco farming uses child labor, keeping children away from school. This traps people and generations in a vicious cycle of poverty and poor health. Strengthening implementation of the WHO FCTC can contribute to food security, better nutrition and education, equity, and poverty alleviation. The environment is also significantly affected by tobacco growing, manufacture, and use. Tobacco farming, manufacture, and consumption contribute to deforestation, soil and land degradation, desertification, greenhouse gas emissions, pollution, global warming, and irreversible biodiversity loss. Cigarette butts are the most widely littered product globally. Cigarette filters are made of plastics that, with sunlight and moisture, break into smaller pieces, contributing to microplastic contamination. They also contain harmful chemicals that can leach into oceans, landfills, and water sources. Tobacco control helps to protect our planet for future generations. But what is the most persistent obstacle to the implementation of effective tobacco control measures? The tobacco industry. An industry that is driven by profits, and to grow its profits, needs to keep people addicted to its products. Tobacco companies have a long history of interfering with governance by weakening public health policies and institutions to preserve their profits and protect their interests. Tobacco industry lobbying can undermine evidence-based policy making and the implementation of the WHO FCTC. Effective tobacco control requires all parts of government to work together in a coherent and coordinated way, avoiding the interference from the tobacco industry to fully achieve the goals of the WHO FCTC. The WHO FCTC includes a range of evidence-based actions to reduce supply and demand for tobacco. These actions help to safeguard public health and can accelerate sustainable development broadly. To reduce the supply of tobacco, governments need to undertake measures to control illicit trade, prevent sales to and by minors, and provide support for economically viable alternative activities for farmers. To reduce the demand for tobacco, there are several cost-effective measures. Increasing tobacco taxes, for example, will reduce tobacco use and prevent future diseases while raising new revenue that governments can use to finance tobacco control, healthcare, or other sustainable development initiatives. By banning smoke in work and public places, people benefit from clean air while further reducing tobacco consumption. Plain packaging can decrease the appeal of the packaging and also increase the effect of health warnings by making them more noticeable. And by stopping all tobacco advertising, sponsorship, and promotion, we can prevent the harmful impact of tobacco marketing, especially on children and young people. This can also help in cessation among users. Tobacco control and implementation of the WHO FCTC require the whole of government and whole of society to come together. This includes protecting public health policies from the commercial interests of the tobacco industry. Curbing the tobacco epidemic is essential to creating healthier and more prosperous communities. It is time to end this epidemic and pave the way for a healthier, more equitable, and sustainable future for all.